welcome back, Facebook family. I'm sorry, already starting off tongue-tied there. Mike is in my face today, making sure that we do a good job today, and right off the bat, he's getting me all tongue-tied. So, welcome back, Facebook family. Again, this is episode number 20. I'm glad you're joining us. I got Dr. Wendy Askew with me, of course.
Hey, everybody.
So, Dr. Wendy is actually here to answer any and all questions that you might have that I can't answer for you. We'd love for you to comment and share or ask anything that you might have a question to. Dr. Wendy has been in this field for now quite a period of time. You've been in medicine for what, over 20 years now?
24 years.
24 years.
Uh-huh.
So she's been a practicing physician for over 24 years, in the military for quite a period of time as well. And of course, then she's also been a great advocate of CBD. So we'd love for you to actually ask her anything that you would have questions about with CBD or any of your diseases that you're interested in knowing about how CBD can work for you and your current disease process. We'd love to We'd love for you to ask any of those questions. So again, like, comment, or share. We'd love to hear any of your commentary that we can answer for you on the air. So we've got a lot of people joining us tonight. That's great.
Yay!
So we've got Dr. Morell joining us from New York, Richard Young, Patty Sandoval, Kim Mendez, California, Jennifer. We've got Addison, Lewis Sandoval, Michelle. Thank you.
Welcome,
Nelson.
everybody.
So hello to everyone. Thank you for joining us again tonight. So we had a great winner last week. Kim Marsalis was our winner last week. She actually won one of our products.
Kim.
So congratulations thank you for watching us last week and asking some great questions and giving us the opportunity to kind of give you some education with what CBD can do for you. So really excited about that. Today we're actually giving away a 250 milligram vial of cream. It's arnica cream. Really, really great product. Works on a topical aspect for you. Really great for inflammation. Works fantastic. We've had a lot of great responses with that just as well. So really excited about that opportunity for someone to win that and try that out for yourself. Like I always tell everyone, proof's in the pudding.
Yep.
So for me,
I love arnica cream. It's great for inflammation and for bruising, to help bruising heal faster. Those of us who are older and get procedures done use it all the time to help things heal.
Like me.
Yeah.
I use it also for my kids' mosquito bites.
Oh, that's a great idea.
We put it on there from mosquito
inflammation.
bites, inflammation. It takes the itch away instantly. It works fantastic. Really, really excited about that. So hello, Patricia Garza. Thank you for logging in, and Felicia as well, and Christy. Thank you for joining in. So today, actually, I wanted to thank everyone that we saw at the Huebner Oaks Farmers Market. It was fantastic.
Yeah, it was
what a great showing. They had like 37 vendors there at the market. It was just all kinds of really, really cool stuff.
Yep, I love that market.
It was us, of course. We're the main CBD company. There was another lady that was selling some CBD products that she made, in her garage or her home, which is okay. I mean, there's a lot of people that are kind of out there doing it.
Sure.
One of the things that we always tell individuals that it's really important that you buy the right products for yourself, because those are the ones that are really going to have the impact in your life. And I want to talk about a story that we actually had this past weekend. But before I get there, I want to talk about the opportunity for that drawing, because actually everyone that was there had an opportunity to sign up for a drawing, and they actually were able to put all of their little cards here into their little winning tickets into the basket. So we're going to let Dr. Wendy pick the winner, because we're giving away that 30-pack of the gummies. So on the air, we're going to pick you now.
You ready? It's Damien Leal.
So Damien Leal, you're a winner from this weekend. You're going to get a 30-pack of gummies.
Woo-hoo.
Thank you for joining us at the show, the Farmers Market on Saturday. We really appreciate the opportunity for you coming out, but we'd like you to try that 30-pack of gummies and let us know what you think. So thanks again for that. And we're going to be doing the Huebner Market again, the Huebner Oaks Farmers Market again. We'll be doing that on August 29th from 9 to 2. It was a really, really good event, well attended. There's probably at least several hundred people that showed up to that event.
I think it's a very well attended market. I've gone before, and it's very nice. Yeah.
It was hot.
It
was really hot. I think they actually shut us down a little early, so we went from 9 to 1 instead of 9 to 2, because it was supposed to get up to 104 on Saturday.
It was
really
brutal.
did.
Yeah,
it was really brutal.
And I got to pop by just for a minute, but it was a really nice event, and there's lots of good vendors, and then of course our products, which is a fantastic reason to join. So August 29th, super.
Well, and our booth was actually right in front of the fresh squeezed lemonade stand. So
perfect.
we bought those containers so you can do the refills for like $3.
Nice.
So I think we all went over there like 4 or 5, maybe 6 times throughout the day, just because we want to get our money's worth.
Good, and you were perfectly positioned for everybody who got hot and thirsty, and then they happened to just walk by the booth.
It was a lot of fun. We had a great time. So also we're going to be doing the Burning Market Days again on September 12th and 13th. That one was really well attended. There was probably over 1,000 people there over those 2 days.
Yeah.
We touched
That's a
lot
great
of
turnout.
lives. Yeah, it really was.
I'm so excited about that. Yeah.
Yeah, it was just amazing because everyone's taking their dogs and there was a lot of there was social distancing, there was masks,
Good.
So it was, even though there were so many people, everyone was taking the appropriate precautions.
So it makes you feel really good, and don't worry about coming out because people are taking the necessary precautions. And then I know you had hand sanitizer for everybody.
We were letting everyone try our hand sanitizer. We sold so much hand sanitizer. It was amazing.
Yeah.
But just giving people the opportunity to try our hand sanitizer was just a lot of fun.
Good.
So, and of course, Mike Anthony gets out there and he's a good salesperson. He does great for that. This hand sanitizer it doesn't look great coming out, but actually the way it feels, the texture and everything else, and the fact that it has 99% alcohol and the witch hazel and the aloe just keeps your hands just
from drying out
on the tea tree oil.
Yep.
So it keeps your hands from drying out. It just really great product. Everyone that tried it was just couldn't believe it that it had 99% alcohol.
I love tea tree oil.
It doesn't. That's right. It doesn't smell like a cheap tequila. That's what everyone says. Because everything you try nowadays, especially those products that are coming from Mexico, they're using ethanol. They're using all these other, anything that's flammable.
And then there's been all those FDA warnings about a lot of a huge percentage of the hand sanitizer products that are out. So you really want to be careful about what you're using when you're trying to be safe. Yeah.
Well, that FDA list, in fact, I have another company that sells PPE and stuff. So we actually get that list from the FDA.
Good.
And there's over 220 different hand sanitizers that have been pulled from the market according to the FDA that are just are so far that they've caught that are unsafe.
Yeah. And you can imagine that there's more going to come by. So yes, be careful, and our product meets all of the regulations and the requirements. It's safe and it's effective.
Yeah. It's great, really good product. So next thing I'd like to talk about was at both shows we just had an opportunity to touch a lot of lives, and the reason I say that is because you and I talked about this before the show. Is I ran into a number of patients that have arthritis, a number of patients who have rheumatoid arthritis, psoriasis, severe depression, PTSD. I can't tell you how many PTSD individuals that we ran into.
Here's such a large military community.
Yes, and also MS.
Yep.
So, and I was so surprised to see so many MS patients.
Yeah.
So over the show, over the last those 2 weekends for 3 shows, I saw 4 serious MS patients with primary progressive disease. So some of them were completely debilitated. Other ones were not as bad. They were still functional. They were spastic. Having where they have the tremors, and they also have the spasticity. And they were having the foot drag and the constant pain. And we were able to just give these individuals a dose of our not our medication, but our CBD, just to see what it could do for them. Because a lot of them, probably most of them that came to the table were like, oh yeah, I've heard of that, and some of them would say, I've heard of that crap, it doesn't really work. And that's fine, because those are the individuals I love to talk to, because I want to make the difference in those individuals' lives, and we did.
Good for you. So tell me what the patient you saw.
So the first one, really young lady, she had MS, and you couldn't tell because the first day at the show at the Burning Market Days, she was super functional. She was out there playing football with her little youngster, throwing the ball back and forth.
Impressive.
So you had no idea she had any disease. The second day she came to the show, she had the foot drag, she had the spasticity, she could barely move
because she'd been overdoing it probably the day before.
And in the sun all day. So she of course had a flare from all that heat exhaustion. So of course her muscles were completely spastic. And we ended up giving her a dose of 1,000 milligrams. So essentially it's about 33 milligrams.
You gave her like a sample.
We gave her a sample dose. I said, look, come back and see us in an hour. We'll give you a second dose, and we'll see how we can get rid of that spasticity. So by the time she came back to us for the second hour, her spasticity was completely gone. Her foot drag was gone. She was actually walking upright. So we gave her that second dose. By the end of the day, you could not even tell she even had MS again. She was back to just being a normal 25-year-old.
So what did she say? Was she blown away?
Oh, she was completely blown away.
That's so exciting.
So her and her boyfriend brought products from us. It was just so amazing to see the impact we can make in individuals.
And had she tried other lines before, or was she totally new to CBD?
So she'd heard about it, but she hadn't been able to get in with her neurologist to really talk to them about it.
Hard.
So she was going out to Oklahoma to see a new neurologist because she hasn't been able to find anyone
Wow.
local that
I
she
do
really
hear about
likes.
that. It's hard to get in.
So she was going to the Oklahoma Medical Research Foundation, which
Wow.
they have a whole thing on it's called OMRF. It's a Center for Excellence.
Awesome.
So they have a whole MS facility and hospital built towards MS.
Do
It's just
you know
amazing.
if they are believers in CBD? Because I know with doctors, it's really all over the place. Some know about it, some don't. And since Oklahoma has a pretty good medical program,
Yeah.
hopefully their doctors are
They
aware.
do. They
Good.
do. I know quite a few of them, so
Great.
I know they do.
Yeah, your
So,
background, of
yeah.
course.
Yeah, and they do. So I talked to her about some of the doctors I knew out there,
Great.
and it's funny she was going to see one of them. So it's
Yep.
absolutely amazing. So
That's
I knew he would.
perfect. So
Yeah.
he'll be thrilled to
Yeah.
hear that kind of a response in a patient. And I think what you touched on is really important because a lot of patients, every single day, without fail, if I mention to a patient CBD, the immediate response I get is, I already tried it and it didn't work. And I just, if people don't want to try it or unopened, I'm not going to be pushy about it. But I think one of the big problems is you don't know what they tried or where they bought it or whether it's got any real certificate of analysis or safety or how it was farmed
Correct.
or extracted or processed, any of that. And I think that the majority of people pop into a shop, buy a vial that seems reasonably inexpensive, and they probably are not getting anywhere close to the strength or the dose that they need to treat themselves. So you just need to have those conversations with patients about being open-minded and really offering them the chance to see some improvement in their symptoms. So I'm so excited that you were able to touch
Yeah.
someone's life.
So I've got another story for you too, but
Yeah.
actually Michelle has a
Okay,
question.
good.
Michelle here wants to know what product would be good for pain after a knee replacement.
So I really like the combination, especially in the acute setting after a surgery when you're still healing and all those nerves are really fired up and sending pain signals. I like the combination of a topical product with a sublingual product because the sublingual is going to get into your system, it's going to work at the level of the brain, and then the topical is going to give you a little bit of an extra boost of the pain relief at the site where the nerves are going to be sensing the pain. So we want to hit both of the areas because there's no pain if you don't have the connections between the body and the brain. So you want the brain activated with the sublingual and then the local effect of the topical. So I like the combination when you're in a lot of pain, like after a knee replacement surgery.
Yeah, absolutely. And we actually do have a really good topical. We have a transdermal topical, which actually has a lidocaine, menthol, and CBD base.
Nice.
And it has two doses. So we have an 800 milligram and a 1500 milligram. So really some great impactful doses that will really really help with that inflammation.
I like it. I've been using it on my subscap when it flares up, the roll-on, and it works great. I get several hours of less pain when I'm
That's fantastic.
doing things that trigger it. Yeah.
Absolutely.
Thank you
that's
for the
awesome.
question, Michelle.
Yes, thank you for that question. Really appreciate that. So the second individual I want to talk to you about is, again, another MS patient. They were at our Huebner Market Days. She actually had primary progressive MS, which she went from a fully functional individual within 1 year already into a wheelchair.
Primary progressive is horrible.
It's really, really bad. It's a really bad disease. Unfortunately, going from fully functional to being in a wheelchair, and you can already see how she already had some contractures on her
Bless
hands,
her heart.
and with the spasticity,
Yeah.
her hand was constantly shaking. She had a mobile electric wheelchair and was still having a hard time because her hand was constantly shaking.
That's so sad.
So I said, look, we'd love for you to try our products. She said, well, I've had another consumer here in San Antonio. I've tried their products. Doesn't really do anything for us. I said, I understand. I said, proof's in the pudding. I said, just let me give you a free sample. Let's just try it. So her and her spouse were there. Her spouse actually was a veteran.
Okay.
Suffers from PTSD.
Wow.
So didn't want to
Both
make
of them.
eye contact. Didn't really want to engage, which is understandable because I've worked with a lot of individuals like that. So I gave him 2 samples of our gummies. So he got 50 milligrams of the gummy. And I said, look, why don't you guys? And I gave her 5,000 milligram dose. So
that's a
she
good
got
dose.
133 milligrams.
Good. That's a good dose.
That's a great dose. So I said, why don't y'all go around, come back in about 20 minutes, and let me know how you feel.
Perfect.
So they came back about 35 minutes later, and she was almost in tears, on the verge of tears, because for the first time in 6.5 months, her brain fog was gone.
And that quick, half an hour or less, and she could tell an improvement. I've seen videos of patients who will take it and then you just watch as they're shaking and their tremors and stuff calm down. MS patients and Parkinson's patients too. The potential benefit from CBD oil is so profound, and that's a big deal for people who can't even control their wheelchair. I mean, it's such a debilitating condition. So to be able to offer them some hope in something as safe and holistic as a plant, and that might augment their therapy if they're not getting great relief, or that they could use as a standalone product, is, I think, just why we do this, right?
Yeah, it's completely. I mean, it was so worth being out in the sun and just,
exactly.
not for sales, but it was just because that opportunity just to see that individual and to know that we made that impact with somebody's life that day.
Yeah.
All well worth it.
I agree.
Completely well worth it.
Yeah, when you can help someone out, that's what it's all about, I think, in my opinion. And you made the comment, I just wanted to touch on the PTSD aspect.
Oh, that's right. I didn't finish telling you about that.
Go ahead.
So when he came back,
yes. Okay,
so remember they came back together.
Yes.
When he came back, he was completely engaged. He was smiling.
Awesome.
He was just like, "Oh, I love this product. It was so amazing." And
so a complete turnaround.
Different person.
Yeah.
I mean, he wouldn't look at all to begin with.
Yeah.
Not making eye contact. It was just.
Yeah.
Just you can tell complete introvert.
Just withdrawn, exactly.
Yeah, complete introvert.
Because of what they've experienced. Yeah.
But just a completely different person when he came back to us.
And I love CBD for anxiety and for PTSD. Like the data for MS, anxiety, PTSD, insomnia is so cool at the molecular level. I won't totally nerd out here with the science, but someday I would love to have a whiteboard and show people. We know from tons of research that people who suffer from anxiety and PTSD have abnormal function in several centers of their brain. The amygdala, which is very simplistically like the fight or flight response center, where fears kind of generate the response. Your heart rate increases, your breathing increases, your blood pressure goes up, becomes over-functioning, and so you're getting these too many signals to be hyper-vigilant and alert, and all the symptoms and things that go along with panic. And then it progresses into PTSD, where even things that shouldn't set off that severe of a response do. And it has to do with the prefrontal cortex part of the brain that sends signals to tone down those nerves that are telling your heart rate to beat faster and your body to go into fight or flight mode. And CBD actually works to restore normal functioning and coupling between those two structures in the brain. So in the acute setting, if somebody has suffered from a car accident or a robbery or something that's inducing anxiety, it would be a great thing for them to start taking CBD to treat their anxiety acutely, and then hopefully to prevent them from progressing against their own, any control of their own, into developing PTSD. So, and right now I think living in COVID, I don't even watch the news or when I scroll through social media, it's just very casually, because all it is.
It's just all bad.
It's all bad. There's no certainty. We don't know when it's going to end. There's no promise of a vaccine yet. Every report seems to conflict itself, and it's creating a tremendous amount of anxiety. And next week I have a meeting that I mentioned to you. I'm going to go to attend the Healthcare Think Tank meeting virtually, and it's all about the mental health impact of COVID-19. And I see it because the patients are all there. And I think this is certainly a better option than SSRIs or than benzodiazepines, which have really kind of crappy data for PTSD and anxiety anyway. So
especially for the youngsters too, because can you imagine trying to put one of these youngsters on some type of antidepressant?
Yes.
It's just, which the problem is you see it.
Yeah.
And because I know they had done that for some of my kids, and I'm so glad they're off of it.
Absolutely.
And they're only using CBD now, but it was nerve-wracking because you see such a high ratio of suicidal ideation with a lot of those medications, and it just it really does, I think, cause more harm than good.
Totally. And some of them particularly, I don't want to name them, but some of the research confirmed that some of those medications increased suicidal ideation and suicidal attempts, and actually some of the pharma companies got in trouble for hiding 4 large studies that showed that. So those medicines definitely have a place for a lot of patients, but they do have some potential risks that parents should be aware of.
So I got 2 questions.
Okay.
First of them is, I've been diagnosed with severe depression. The medication isn't helping at all, and this is the second medication I'm on. What do y'all have to offer?
I think CBD offers some help. I absolutely do. When you look at the mechanism of how depression and anxiety occur in our brain, CBD can help. We never promise, but it's absolutely a very safe adjunct or replacement that you could try. We don't want to delve into your history and the circumstances and all of that. And I think having a good therapist is critical. But the CBD is something that can really help to attenuate the mood symptoms
Absolutely.
and the anxiety component. So I definitely think it'd be worth trying. And what are your thoughts about the dose? Because I really feel like people don't start with a strong enough dose.
So I always tell a lot of our consumers, really 1,000 milligrams would be ideal to start with.
Yeah.
And even giving them a loading dose.
Yes, I love
so
the
we
loading
talk about
dose.
a loading dose of usually 1,000 milligrams in the morning, maybe 1,000 milligrams in the evening.
Yes.
And doing that for the first week, and then titrate down,
Yes.
and then see how they work. After 5 to 7 days, once
Okay.
it gets into their
Okay.
system. I'm not sure what you would.
I would agree. Did you say when you say 1,000 milligrams, you would say of the 1,000 milligram
Oh,
vial?
one tincture. I'm sorry.
One dropper full.
One
right?
dropper full. Yes.
Which is still a low dose.
Yeah,
right?
it really is. It's 33 milligrams essentially.
Exactly.
So it's 66 milligrams a day.
Yes.
Over the first week,
Right.
and then once they get into that plateau area where
Kind
they're
of
feeling
primal.
really good,
Yep.
then titrate it down.
I
Now,
agree.
if they get to a point where they're starting to get anxious again, then we know
Increase.
that dose has to go higher.
Perfect.
We'll know when the next time they come in, they have to buy a higher dose.
Everything that I've read and seen also does support. All the experts do say that a loading dose is very helpful. So either the 1 full ml or even 2 in that setting, because it's not going to make you feel, anything. You're not going to feel tired or groggy or loopy or anything like that.
You don't have to worry about
Correct.
driving, or you don't have to worry about being under the influence. You can
Correct.
still function fully on our CBD. There's no worry about losing any type of impairment at all.
Yep, agreed, 100%. And
So-
there was another question. Sorry, thank
Yeah,
you.
thank you for that question. I really appreciate it, Patricia. The second question we have is, can CBD help with GERD or acid reflux?
I know that THC helps beautifully with GERD and acid reflux, but we are still in Texas, and the amount of THC contained in the CBD might, because they all work together to kind of synergize their effects. So since CBD does contain very small, almost trace amounts of THC, I think it could give you some relief. I know that higher doses of THC have an extraordinarily beneficial effect on GERD and acid reflux. So the answer is probably. And hopefully after the next legislative session, we'll make some progress with the THC piece.
So Dr. Morrell actually has a question. Can you expand on how CBD works with the neurotransmitters?
Yeah, so it's interesting. I don't know if that was a feed question or not, but I appreciate it. So CBD acts at the neurotransmitter level. They kind of refer to it as a biological harm reduction technique. And so the way nerves communicate to each other, if my fists are one nerve cell, a neuron talking to another, the endocannabinoids, which are our body's cannabinoid molecules, are produced when needed. So if there's a signal, if I suffer some sort of an injury or an insult that starts to send signals to experience pain or to increase my heart rate or to cause an effect, that signal should happen, and then it should kind of dampen and the effect should go away. When it doesn't, and there's too much of a pain signal being sent or too much of an anxiety signal, the endocannabinoids on this end start to get produced, and they circle back and they actually shut off calcium channels to decrease the release of excitatory neurotransmitters like glutamate that would stimulate more of the too strong of a signal being sent. So it's kind of an on and off switch. They affect GABAergic receptors in production and glutamatergic, I forget how the exact word, but it works at glutamate and GABA at the level of the neurotransmitters. And then downstream, whatever neurotransmitter or hormone or pain signal is being released is either turned up or turned down as needed, if that makes sense.
That's fantastic.
Yeah.
So Dr. Morrell, thank you for that question. That's a great question. Appreciate that.
Yeah, thank you.
That's really, really good. And then, David, thanks for joining us. Good to see you. And the other thing I want to talk about is, I think we talked about the PTSD.
Sure.
One of the things I think I've seen also in children is not necessarily the PTSD, but
Okay.
sometimes the depression, especially, unfortunately, especially in today's society, divorce is such a common aspect of what these new families kind of go through.
Sure.
It's so much different than when our grandparents were married and you're married for life and, share with your companion.
Right.
So my kids have gone through divorcing, unfortunately.
Mine too. too.
So we've lived through that, and that's really hard on them. You know, unfortunately.
Yeah,
so
it's awful.
My kids, sometimes when we talk about different anxieties, that's one of their anxieties.
Sure.
Is not being able to find the right person, the right individual, and they develop a stress a level from that. So a lot of times, we talk about using this product for maintaining daily stresses, but
Sure.
it's also some of their general anxieties of what life holds for them. And that actually, even if you're not a clinically diagnosed depressive person,
Sure.
I notice also when I tell my older kids to take our products and they use them, their onset of what life looks like changes.
Yeah.
It's so much more positive.
Yeah, it's wonderful.
It really is.
Absolutely. My kids are frustrating. Like the older one has struggled with anxiety and depression, and it just, if she hears it from me, then it probably doesn't mean anything. It has no validity. But if she hears it from you or from one of her doctors, then she'll try it, and I just have to nod at, and give her kudos for trying it. But it makes a huge difference. And I've told you that I help. One of the aspects of PTSD and anxiety is nightmares, and so CBD helps to restore restful sleep also. And
yes.
So I think that's an important piece. The kids need sleep, and especially now with their schedules disrupted from summer vacation, I think the CBD can be great for the kids to help balance.
Oh, and it's been amazing because my kids actually use our melatonin and CBD.
Yeah.
My 12-year-old uses it religiously because she suffers like I do with severe insomnia, and I just don't understand it because it's we try to get her the whole thing with sleep hygiene, but I think with her it's just they're so much into electronics.
Yeah,
my son's at the point where I can shut him down. He's 9, so I can still shut him down. My older one, she gets in this thing where she goes to her room and she'll hide under her covers or this or that. So of course those lights and those blue lights kind of keep their brain stimulated.
You don't realize how bad that is and how prevalent they are everywhere. So I think that's great. And for a while I even got my 12-year-old to listen to the Calm app going to sleep, and she would listen to the white noise just to try to turn your brain off to help it restore normal sleep cycling. And there's data on CBD helping our brains to go into stage 3 sleep, which is the repair level of sleep. And so that's obviously really important, and to let them sleep longer so that they'll have more cycles in that stage 3 sleep. And I forgot to mention with Dr. Morell, I kind of just explained how the neurotransmitter piece works, which I'm sure she knows. But so the cannabinoids in CBD, and there's dozens of cannabinoids in CBD, and we're only talking about in cannabis, we're only talking about CBD and THC really, but there's tons of other pharmacologically active chemical compounds in the plant. But so they look like the ligands or the chemicals that our body produces. And there are a lot of reasons why we can't produce enough of our own receptors or enough of our own endocannabinoids. And so when we can't, that's one reason why our health becomes unbalanced. And so taking CBD can kind of act on those receptors and do the job that we're not able to do because of inadequate production or receptor levels.
Yeah, It's amazing. So aren't you all amazed just how much knowledge this woman has? She's just absolutely amazing. Thank you so much for being on the show, because it's so nice to actually hear somebody kind of go into the biophysiology of what this plant can do, and it's really, really great. I'm
a total geek. I just love.
I love it.
I love this
I absolutely
stuff.
love it.
It's so exciting.
And I think
fascinating.
this is what our consumers need to know. It's great that you're now a business partner with us and our medical director. So I'm really excited about the opportunity of you kind of continuing to educate our population, our consumers, our patients, because it's really is an opportunity for us to continue to make an impact in your general wellness and our general wellness and the impact of overall health for everyone. So I'm really excited about it.
Anybody who knows me knows that I can just talk and talk. So you'll have to come up with a signal for me if I'm getting too deep in the weeds, like tone it down, since I can't see their eyes glaze over if I'm talking about neurotransmitters and receptors and stuff.
Well, guys, I don't see any more questions coming in, but I'm really glad that y'all had the opportunity for asking these questions tonight. And yes, I'll stop tapping on the table. I appreciate that. But I will. I want to make sure that everyone had an opportunity to ask you questions. If you have any questions, right now is the opportunity before we go for the drawing for tonight's show. Mike, did we have a winner for tonight's show?
I thought we did, right? Damien? Oh.
Well, that was for the gummy giveaway for over the
perfect.
weekend.
Okay, there's an online drawing. Sorry.
There's an online for all the individuals who showed up tonight.
Okay.
Actually, Sandoval. So why don't we go with that one for tonight? Patricia Sandoval.
Yay!
So yeah, let's go with that one first. So we got Patty Sandoval who's watching us tonight. We appreciate you watching, Patty. Good to have you on our show. If y'all have any questions about this, actually, Patty was able to win one of our topical creams. Works fantastic for pain, for any type of
itching.
Joint inflammation, itching. It works fantastic for that. So we hope that you enjoy that product. Join us again next week, Tuesday night. We'll have another opportunity for you to kind of share, ask any questions that you might have, gather your information that you might need answers on. We'd love to be able to answer those for you.
Yeah.
Thank you so much again for joining us as usual.
We should
Just
do a whole
wealth of
episode
information.
on skin, right? Because of the
That would be
itching and the
great.
inflammation and the acne and the anti-aging.
And if
Yeah,
y'all
that's
have
my
any
favorite
ideas,
topic.
guys, that you'd like us to talk about,
Yeah.
we'd love to hear your information. Send in text us. You can actually call our office, email us, or just send us a
Maybe they
message.
could post questions on the page.
Post questions on our empirical page. We would love the opportunity to answer those questions for you. We come up with those questions throughout the week. Just send them into our homepage. We'll actually answer them on the air. So we'll look forward to talking to you again, or interacting with you guys again next Tuesday night at 7:30-ish. We were a little late today.
Sorry.
We
had
apologize
technical
for that.
difficulties from the storm.
Yes.
Yeah, we'll blame it on the storm.
Yeah, that's what it was. All right, y'all have a good night.
Thanks
We'll
for
see you next
tuning
week.
in. Bye-bye.
Bye-bye.